Hello, my name is Andy Zeiger. I'm going to be talking about my research, trying to understand how pediatric primary care providers think about nature exposure, think about counseling on nature exposure with their pediatric patients, and what they know about the field of horticultural therapy. And this is based on a survey in Philadelphia. So there were two aha moments that have exposed me to the importance and power of gardening and inevitably brought me to the field of horticultural therapy. So that picture on the left is of me after having just completed a trail in my parents' backyard. I have type 1 diabetes, and when I started learning to garden and work in my parents' backyard, I realized how stabilizing the activity was for my blood sugar, and it would stay stable for the next 24 hours after gardening. And that became a really important moment of trying to understand, wow, this is a really important intervention for me in helping stabilize my medical condition. And then the picture on the right is of a garden in New Jersey. And during a family medicine clerkship, I got to visit this garden, and I got to meet a patient, the kid in the red shirt in the background there, who had been hospitalized with suicidality as an 11-year-old 4 months before I had met him. And when I met him 4 months later, after his only primary intervention being this gardening program, he was leading, he was wonderfully engaging, and it looked to me like the program had worked wonders for him. And the program had been supervised by a horticultural therapist, and that became a really important moment of understanding, wow, there's a whole field that tries to explore how gardening can be used for health. And then more personally, my family had a tragedy during the COVID pandemic. My cousin Elizabeth, who's in the purple shirt here, the super smiley, wonderfully friendly girl who, when you talked with her, she was so engaged. And she also lived her whole life with a weight that put her in a category of having pediatric obesity. And then during the COVID pandemic at 19 years old, she died from a stroke. And I think it's reasonable to infer that complications of her obesity increased her risk of a stroke and increased her risk of death. And that became a really important moment for me because it taught me that we need to be aggressive about helping our children live healthy, nutritious, active lives with positive sleep and good mental health. And any tool that is effective, safe, of reasonable cost, and backed by evidence needs to be incorporated into our medical toolkit. And that's what I see horticultural therapy being. So I'm a medical student. On the left side of this slide, you can see this is our medical school curriculum, and I am here. I just started doing my interviews for residency, and I'll start residency in the coming summer. And I'm going into residency as a pediatrician. So before I go into the background of my research, I want to just describe what my research is. My mission is to understand the extent to which the medical community knows about horticultural therapy and counsels on increasing nature exposure. My research question was, what are Philadelphia area pediatric primary care providers' attitudes and practices regarding nature exposure counseling and horticultural therapy? And my method was surveys sent electronically to providers. And I'll get into that more in a bit. Before that, I want to dig into, that's a picture of me digging, 7 concepts that drive my research and really form the backbone of why I'm so convinced that horticultural therapy needs to be incorporated into medicine. So first is, it kind of goes without saying, but our continuous improvement of healthcare is absolutely critical to our nation's health. And I have pictures here of the Declaration of Independence and the Constitution. And what our nation was founded on were the ideals that individuals should run the government, and individuals should be empowered to lead and empowered to have sovereignty. And now I'm not saying that we've always lived up to our ideals, but those are our ideals, that we want to empower individuals. The Declaration of Independence broke our ties with Britain and basically put forth what a just government would look like. And then the Constitution created a framework for how that system would actually function. And I think going back to these ideals should be something that we consider when we try to improve medicine, because I think the practice of horticultural therapy is absolutely in line with the guiding principles of our country, and that it can help empower people to have more control over their lives. And it really goes without saying that we are spending so much money on healthcare. Since 1960, when healthcare made up about 5% of our GDP. And then after Medicare and Medicaid were passed in the mid-1960s, the healthcare expenditures as a percentage of our GDP has more than quadrupled. And it's unsustainable. And always we must think about ways to reduce the burden on our entire economy. And I'm not convinced that the way we spend on healthcare is actually producing the results. If you compare US life expectancy at birth to other wealthy nations, we are among the lowest life expectancy, and our life expectancy has actually been dropping over the past 3 years. And again, and we hear reports about this, but this is a paper from the New England Journal by the Surgeon General, Vivek Murthy, talking about how healthcare worker burnout is such a prevalent issue. There was a study by the AMA showing that 1 in 5 physicians were planning to leave practice within 5 years, and that was in 2022. And then in 2021, there was a study showing that bedside nurse yearly turnover rate was almost 20%, and a third leave due to burnout. So anything that we can do to try to target burnout is important for our nation. And I think all of this needs to be said in the context of, I believe our country represents a beacon to the world. And this graph showing the top 10 countries with Nobel Prize laureates in medicine over the last 120 years shows that we move medicine forward as a nation. What we do here drives the world. And I think horticultural therapy here should be more incorporated into our medical system. And if done here correctly, can be a model that gets incorporated across the world. So the second piece of information that forms the background of my research is that we live in a truly unprecedented digital age. The first smartphone came out in 2007. Almost all of the kids that I see in the clinic have no idea that there was a time before smartphones. And the research is showing that kids are spending an incredible amount of time on screens. So this study was from 2020, and it showed that the average screen time for 12-year-olds was a little less than 8 hours per day, and the standard deviation was 5.7, meaning about 15% of people in this data set were spending over 13 hours a day on a screen. And you can see significant racial and ethnic disparities in total screen time per day. Now, the important question is, are screens bad for children? And it completely depends on a lot of factors. And I think it would almost be dangerous to just outright say screens are dangerous for children because it depends on age. What might be appropriate for a 13-year-old would not be appropriate for a 2-year-old. It depends on content. So some things that somebody might see online can be extremely dangerous, whereas other things might be teaching them how to do math or programming. The context is important, who you're interacting with online. Somebody zooming into a family get-together is very different than somebody spending hours at home alone gaming. And then the total amount of time that you spent on the screen is also important. So as I was already alluding to, the context is so important. So kids spending their time on iPads at the dining room table is probably more dangerous for their social, emotional development than kids who are using iPhones or using tablets to FaceTime and video conference with family or friends. And again, spending hours at home alone gaming is different than using augmented reality or virtual reality for medical education. So are screens bad for children? There are 4 considerations where we actually do have significant evidence to suggest that screens really can be bad for children with respect to obesity, sleep, development, and attention. So specifically with obesity, the odds of being overweight are almost 55 times greater for adolescents who watch more than 5 hours of TV per day compared with those who watch 0 to 2 hours, and that was from the 1990s. And then a 2014 study showed that 2-year-olds had a BMI increase for every hour per week of media consumed. And potential mechanisms for this could be that the more time you spend indoors or on a screen means less time spent in natural environments, and you might have less exposure to things that might regulate and improve your normal physiology. Other mechanisms would be displacement of activity, increased snacking while on the screen, and advertisement exposure for things that are unhealthy, like snacking or fast food. So another important consideration is sleep. We know that the increased duration of media exposure in early childhood has been associated with fewer minutes of sleep per night. And sleep is when so much of our brain's neural pathways are being consolidated, and kids' brains are developing so fast that they need all the sleep that they can get. We also know that infants exposed to screen media in the evening hours have significantly shorter nighttime sleep duration than those with no evening screen exposure. And some mechanisms that have been described for this are that the screen has arousing content that prevents you from falling asleep. And very interestingly, we produce a chemical in our brains called melatonin. That melatonin is secreted in response to darkness. So as the day gets darker, we secrete more melatonin, and the melatonin prepares our body for sleep. But blue light exposure actually suppresses the production of melatonin. So the more light we're exposed to, we're basically tricking our brain into thinking that it is still daytime and we still need to be awake. And then lastly is for development and attention. So a recent study showed that children who spent greater than 2 hours per day on a screen scored lower on language and thinking tests. And some children who had greater than 7 hours per day of screen time experienced thinning of the brain's neocortex. And that's the part of the brain where our personality comes from and our higher level thinking comes from. And some mechanisms for this would be that screen use does not contribute to normal social emotional development. And that development is so rapid during childhood and is often engagement based, whereas screens do not allow for much observation and interaction. And children learn best with that back and forth dialogue. So there's a clinic at Boston Children's called the Digital Wellness Lab that described this term called problematic interactive media use, which is 4 ways in which people can overuse their screens. They can use it for seeking information, for pornography, for social media, and for video gaming. And there's actually a DSM, a Diagnostic and Statistical Manual of Mental Disorders, which is basically the Bible for psychiatry and psychology. And there's actually a DSM diagnosis called Internet Gaming Disorder. And you can kind of see the criteria here. The criteria is if somebody has impairment or distress based on these 5 of 9 criteria, including preoccupation with gaming, withdrawal symptoms such as irritability or anxiety when gaming is taken away, tolerance, meaning they need more of the game, and unsuccessful attempts to control their participation in gaming, loss of interest in other hobbies or social engagements, excessive use while still being aware of the risks of psychosocial problems, deception to continue using games to escape or relieve a negative mood, or having games that have jeopardized or lost a significant relationship. So the point I'm trying to make here is that the medical community is aware that we are in a new era in how children are interacting with screens. And we have to have, not only do we have to have a better understanding of the prevalence of the problem, but we need tools to help children. And I really believe horticultural therapy can be one of those tools to help children balance the digital age. And this is actually something that I've published on in the AHTA magazine. This was an article published in the summer edition of the magazine, where I basically described that we can use tools to connect with nature. And in this article, I include as many tools that I could find of examples of ways that we could use digital tools to engage with nature. So these are citizen science tools, things that help us with identification, field guides, nature communities, or garden and outdoor care. And so the point that I'm trying to make is that we're in a new age, and it does not make sense to me to tell a child that you should not live with a screen when all of their peers are living with screens. And actually, digital literacy is a really important part of participating in our modern economy. What I think our approach should be is helping kids have healthy, balanced relationships with screens. And I think balancing the screen use with nature exposure is a wonderful way to make that relationship more healthy. So the third piece of information that forms the backbone of all of my research is that children in our society have grown divorced from nature. This study from 2018, from a large study called The Nature of Americans, suggested that 12-year-old children in the US spend an average of less than 6 hours per week outdoors. So 6 hours per week outdoors compared to over 8 hours per day on a screen. And there's a great book by Richard Louv that came out in 2005 and was republished in 2008 called The Last Child in the Woods. And it just provides more of a historical context for how this divorce took place. And I think it's important to mention that only 15% of the world's coastline remains in its natural state. So having young people who care about the environment is going to be extremely important as we move through more climate instability. And nearly 1 billion people live within 10 kilometers of coastline. So what that tells me is that if only 15% of the world's coastline remains in its natural, healthy state, and nearly 1 billion people live within 10 kilometers of coastline, that tells me that as these coastlines continue to be dysregulated, we're going to see a lot of human migration, and there is going to be significant problems to our world. So anything we can do to train our young people to be citizen scientists and environmental stewards is extremely important. And I think horticultural therapy is a tool that can do that. So the fourth piece of information that forms somewhat of a backbone to my research is that children are facing crises in unhealthy weight and nutrition and mental health. So first, with unhealthy weight and nutrition, this graph is showing that the prevalence of pediatric obesity in the United States has quadrupled since the 1960s. So pediatric obesity is defined as having a BMI of greater than the 95th percentile, corrected for sex and age. And early in 2023, in January 2023, the American Academy of Pediatrics released its first ever clinical practice guideline for evaluating and treating children and adolescents with obesity. And there was one sentence in this guideline that I thought was so telling about where the future of our country might be going. That sentence reads, "A predictive epidemiological model estimates that if 2017 obesity trends hold, 57% of children aged 2 to 19 years will have obesity by the time they are 35 years in 2050. That is stunning. That's saying that in about 25 years, the kids of today, around 60% of the kids of today are estimated to have obesity 25 years from now. So in terms of national security, in terms of individual health and well-being, that is a very, very scary prospect and something that we have to be very aggressive about as a society to prevent from happening. And in terms of the mental health crisis facing children, so this article was published recently in 2021 in JAMA Pediatrics, describing how the COVID pandemic has been a global call to action. And they write that we are experiencing a global public health crisis in youth mental health that began long before the pandemic, and we must advocate for implementation of evidence-supported practices that are scalable, expands access to care, and eliminates disparities worldwide. And I truly, truly believe that horticultural therapy is one of those interventions. So the fifth piece of evidence that supports my interest in horticultural therapy is that it is evidence-based. It is practiced in many clinical settings. It has many cost-saving applications, and it's well-regulated. So first off, in the last 15 years, in the last 10-ish years, actually, there have been at least 6 studies showing the benefit of horticultural therapy. So systematic reviews and meta-analyses, they collect data from a large number of typically randomized controlled studies, and they collate the data to see if the effect size is significant across a large range of studies. And what they're showing is that the effect of horticultural therapy is significant for schizophrenia, for academic performance in children, mental health conditions in adults, dementia, general health in older populations, and cognitive function. And I find this to be so incredibly exciting because I am aware that this all has been taking place over the last 40 years. And we are at a moment right now where the evidence is strong. The evidence is extremely strong in support of horticultural therapy. And then I want to kind of talk more about some of the theoretical frameworks that try to describe why horticultural therapy has the benefits that it has. And this will be review for probably most people on this presentation, but I like to be complete. So E.O. Wilson, a biologist, wrote Biophilia. Biophilia is a evolutionary way of thinking about our relationship with the natural world. In his book, he describes how we have evolved a inclination towards nature. We have evolved in seeing nature as beneficial and a fitness advantage. For example, if you see grass or plants, that suggests there's water nearby. That suggests that there might be food nearby. That suggests that you're in an area in which you can raise your young. And to me, those are the three most important ingredients for life: food, shelter, and an area in which you can raise your young. Next, we talk about Ulrich. And Ulrich, again, most people here probably know, has been a huge pioneer in trying to understand how nature can affect patient outcomes. Ulrich did the landmark study of A View from a Room, showing that patients who were recovering from surgery did better, had fewer inpatient stay days, required fewer pain medications, and had higher satisfaction when they had a view of nature versus if they didn't have a view of nature. And the idea behind stress recovery is that when you are recovering from any stressful exposure, there are elements that can make it easier for you to recover or make it less easy for you to recover. These elements include perception of control, social support, and positive distraction. And nature provides all of these things. So another theoretical framework that supports this work is from the Kaplans, the idea of the restorative environment of nature. So they wrote in the late 80s and 90s about how restorative environments must meet the following qualities. They allow us to separate from our thoughts and concerns, hold our attention effortlessly through fascination, soft, which are less stimulating or observation-based, or hard, which are more stimulating or activity-based. Restorative environments immerse us and engage us with such richness and coherence that they constitute an other world, and restorative environments create opportunities for an enjoyable interaction. And this is important because the ability to be restored creates the platform for us to interact in a purposeful way in our day. And what they describe is that as somebody is directing more focus or directed attention towards a task, there hits a plateau point where they have a fatigue, where they have a loss of focus. And exposure to restorative environments such as nature and the effortless attention that we can give to nature helps to restore our focused attention or our directed attention. Next, I want to talk about the neurosequential model of therapeutics. And I think this is an incredibly interesting way of thinking about how nature has value in human health and physiology. And so the way I kind of think about the neurosequential model is thinking about the entire central nervous system as a cohesive unit of individual components. So what this figure is describing in red is the brain stem. So the brain stem comes off of the base of the brain and it projects downward into our spinal cord. And we get sensory inputs from the environment that go up into the brain through the brain stem. And then we get motor output that comes down from the brain and tells our limbs what to do. And then we have the diencephalon, which also in red is a group of structures that surround the thalamus. And then we have the limbic system in yellow. This includes the amygdala, the hippocampus. The amygdala is for emotions, and hippocampus is for memories. And this allows us to form relations with other people. And then we have the neocortex, which is our highest level form of thinking in green. That's where our personality comes from. That's where our decision-making comes from. And the point is that horticultural therapy conditions all of these units, regulates all of these units, and can integrate them together to make our central nervous system into more of a cohesive unit. And so specifically, if we're looking at the brainstem and the diencephalon, the brainstem, as I mentioned, it takes in sensory input. So any horticultural activity you do that gives the person in front of you lots of sensory input, that is going to give strong signals through the brainstem. So things like garden walks, weeding, watering, digging. And then the diencephalon, which is about self-regulation. The diencephalon is where we have the thalamus, the hypothalamus. This is a structure, and you can see it right here. This is a structure that actually projects between the higher level brain and the more reptilian lower level brain. So it's basically integrating information across the central nervous system. So things like tool building, weaving, building walls, rhythmic activity, things that help you self-regulate can target your diencephalon. And then we talk about the limbic system. So this includes the amygdala, the hypothalamus, the pituitary gland. And so it's believed that the limbic system develops in our response to raising young, that it's a fitness advantage to have a brain that is geared towards raising other living animals, because the more of your peers that are alive, the more likely it is that you will survive too. And so things that can condition and regulate our limbic system are things that are relational in nature. So husbandry, harvesting, fertilizing, paired gardening, and tree nursery care. And then the neocortex, this is our highest level form of thinking, where our frontal lobe, where our personality comes from, where our temporal lobe and our sensory and motor cortex are. So this is where our personality is built. So things that are higher level cognitive problem solving are going to stimulate, regulate, and condition the neocortex. So things like botany, irrigation, composting, project management, anything that requires higher level thinking is going to condition the neocortex, and in the process, integrate all of these domains together. All right, and then another pathway that's really important to think about in terms of why does nature promote human health is through what's called immune functioning. So there are all these things that we are exposed to in nature. So things like phytonicides. So those are little volatile compounds that are just in the air we breathe. The more you're in nature, the more diverse the type of phytonicides you're exposed to. Negative air ions, microorganisms, environmental biodiversity, improved air quality. All of these things have a central pathway of improving immune function, and so many health conditions result from immune dysregulation and dysfunction. So the thinking here is that improved immune functioning, improved immune regulation can actually have its own health benefits. And then it's important to think about the developmental perspectives to understand nature's benefits. So this is Brofenbrenner's social ecological theory. It's looking at the idea that the individual develops within a massive network of interconnected systems. And one of those systems is the natural environment. And how they interact with that natural environment can play a huge role in their development. And then another developmental perspective to consider is attachment theory. So attachment theory is examining how our early life interactions with a primary caregiver can shape our relationships moving into adulthood. The idea being that the way you're treated by an early caregiver helps you think and gives you a script for how to think about the world. So what this graph is showing is on the x-axis is relational anxiety. So as we go from secure attachment to anxious attachment, we're seeing that the individual has more anxiety in their relationships. Individuals with secure attachments have low relational anxiety. And then on the y-axis, we see relational avoidance. So those with secure attachments have low relational avoidance. They don't want to avoid relationships. They want to engage in relationships. Whereas those with high amounts of relational avoidance have an avoidant attachment style. So specifically when we think about secure attachment, we're thinking about an individual who had a caregiver who was attuned to their needs, who was present and consistent. That caregiver made the individual feel like the individual could express themselves and be themselves without fear of being abandoned. As a result, the individual develops a secure attachment style of low anxiety, low relational avoidance. They're more trusting. They are comfortable with intimacy. They have healthy coping styles. So secure attachment is a very pro-social way of interacting with the world. Avoidant attachment. So this is an individual who had a caregiver who was unavailable, who was disengaged, who was rejecting of the individual. As a result, you just don't care. You avoid relationships. They don't give you any anxiety because you just don't care. And you can imagine how that is a very antisocial approach to life. And we have anxious attachment. So an anxious attachment, we have a caregiver who was inconsistent, who was unpredictable, who was available one day and then totally disengaged the next day. And what that teaches the young individual is to have lots of anxiety when they approach their relationships, and to not avoid relationships. They actually want to engage in relationships because they want to feel accepted. And so in response to this attachment style, people would be anxious, they would be confused in their relationships, they'll be afraid, they'll have a lot of negative beliefs about themselves because they learn from an early age to not know whether they're going to get love or disdain from their caregiver. And then we have disorganized attachment. So that's typically an individual whose caregiver was either frightening to the child or frightened by the child's needs and had a fight or flight response themselves when the child needed something. So in response, this individual has a lot of challenges with emotional regulation. They feel unsafe in relationships. And the importance of attachment theory and how it relates to horticultural therapy is because I believe that it's possible to have a secure attachment with nature. And that is something that can be cultivated at an early age. If we think about what secure attachment means, it means that that somebody was attuned to your needs, was present, was consistent, did not make you feel abandoned. I think these are things that people can find in nature. They can find consistency in nature through pattern recognition. They can feel the opposite of abandoned. They can feel connected in nature. And as a result, because of forming a strong relationship with nature, you're developing a script that makes you more trusting and less anxious about forming relationships with other people. And the point being that engaging nature may help people develop more secure attachments, which is a pro-social behavior for all of society. So then continuing on with this way of thinking, horticultural therapy is practiced in many clinical settings. This study in 2022 from the Journal of Therapeutic Horticulture suggested that, actually the combination of these two studies suggested that there's around 148 horticultural sites and activities across the 6,100 plus US hospitals. I think that's an incredible accomplishment. And I've seen a lot of these horticultural sites, and they are wonderful, and they provide an incredible service. I do believe that we can grow, and I will talk about that in a bit. The reality is there are just 19 HTRs who are self-reported to be working in hospitals based on this paper right here, the Horticultural for Health activities. And just some examples of hospitals that have already incorporated horticultural therapy and gardening into their clinical environment are Rainbow Babies and Children's Hospital in Cleveland and Sydney Children's Hospital in Sydney, Australia. And next, I want to talk about how HT is such a cost-saving activity. There's lots of data that greening healthcare areas is tied to saving costs. So some of the variable expenses facing hospitals are burnout, employee turnover or replacement, patient length of stay, utilization of medications and services, workplace productivity, absenteeism, medical error, and defensive medicine. And there's data to suggest that the greening of healthcare sites can actually have benefits in all of these domains, especially in burnout. So this graphic is from the site called Nature Sacred, which created a calculator to help healthcare systems calculate how much money they could save from incorporating a garden site into their healthcare facility. And then lastly, I believe HT is a very well-regulated system. I'm speaking to the choir here. The AHT has been around for over 50 years. And my experience in talking to people in AHT has been really just wonderful. All right, so then the next thing that I want to talk about is how HT has the potential to be an incredibly invaluable tool for children's health. There's something called the Positive Youth Development Framework for Fostering Strong Young People. It was formed out of this massive interagency working group of all these different federal programs, including U.S. Department of Homeland Security, National Endowment of the Arts, and AmeriCorps. And what the Positive Youth Development Framework suggests is that fostering young people requires these four ingredients. We must provide environments of positive pro-social behaviors. We must focus on personal agency, so focus on the individual's intrinsic strengths and individuality, teach them skills that they can use as assets throughout their life, and give youth opportunities to contribute and lead. So in more of a graphical way, it's basically an enabling environment, personal agency, assets, and opportunities to contribute. And to me, this screams horticultural therapy. Horticultural therapy absolutely cultivates positive youth development. Horticultural therapy it allows places where people can get support, where they can bond with like-minded individuals, where they can get physical activity. So the horticultural therapy environment is an enabling environment. It helps them have agency because people learn how to interact with the world. It gives them assets, skills that they can use in their life, and it gives them opportunity to lead and contribute. So a specific application of horticultural therapy is to pediatric obesity. So again, looking at this clinical practice guideline, the mainstay of treatment for pediatric obesity is this intensive health behavior and lifestyle treatment. This involves visits of sufficient frequency and intensity to facilitate sustained healthier eating and activity habits, and family-based therapy as the intervention ensures best outcomes. And the reason I bring this up is because at Duke, they have a program called Healthy Lifestyles, where they've actually incorporated their pediatric obesity clinic and partnered it with the local Parks and Recreation Department. And this protocol from 2023 describes how effective a pediatric obesity model that incorporates parks and recreation into the pediatric obesity intervention can be. And I see this as a massive opportunity for horticultural therapy. There are over 20,000 sites for parks and recreation across the country. This is something that I think horticultural therapists should be involved in. HT has the potential to encourage long-term environmentalism, which we know is going to be extremely important for the future of our society. HT has the potential to promote good nutritional habits. And then all of these other things. HT has the potential to increase joy, improve social connectedness, reduce stress, improve cognitive development, promote self-control behaviors, improve attention functioning, long-term environmentalism, and then decrease long-term risk of psychiatric illness. So clearly HT has so many potential benefits. And then the last thing that I want to talk about, the seventh piece of my background, is that primary care is changing so rapidly. The entire medical system is changing so rapidly. And I believe a primary care model that develops young people at the earliest age to love nature, to take responsibility for the natural world, is developing them to steward society, take care of each other, and take care of themselves. And this picture is of One Medical. It was a primary care group that was started about 15, 20 years ago, and it was recently purchased by Amazon for $4 billion. The point being that there's lots of innovation in this space, and I see incorporation of HT into primary care as a model that would be extremely effective for kids. Okay, so those are my 7 things and that formed the foundation of why I so strongly believe in horticultural therapy. But now I want to transition into my actual research. So again, my mission was to understand how the medical community thinks about horticultural therapy and counsels on nature exposure. And my question was, what are Philadelphia area primary care providers' attitudes and practices regarding nature exposure counseling? So there's a few approaches to this. I'm going to talk specifically about how I send surveys to Philadelphia area providers, and that's right here in orange. So our methods we took from this 1999 journal article from the American Journal of Preventive Medicine on exercise counseling, where physicians were identified through administrative lists at 4 hospitals and sent emails and letters from those administrative lists. So that's what we did. We had 11 Philadelphia area health networks and 7 Philadelphia area federally qualified health centered. We got 4,187 emails from those lists, 664 bounced back for a total N of 3523, and our total response was 231 for a 6.6% response rate. This is what the survey looked like. The image on the right just shows what our inclusionary criteria was, which was the respondent being a physician, advanced practice registered nurse, physician assistant who takes care of pediatric patients in a primary care setting. From our demographics, about half were from pediatric background, half were family medicine, 84% were physicians, 15% were APRNs, and 1% were physician assistant. Geographically, about half were suburban, half were urban, and the remainder were rural or other. And then practice type was 38% academic, 34% hospital corporation, 20% provider-owned practice, and 9% public care. And then this is just showing the percentage of our respondents' patients who receive public health insurance as their primarily for socioeconomic reasons. And you can see that a quarter of our respondents had a quarter of their patients who receive public health insurance, a quarter had a little bit less than half, a quarter had a little bit more than half, and a quarter had almost all of their patients on public health insurance. The point being that I believe our sample was a representative distribution based on socioeconomic status of their patients. So kind of jumping into the data, this question was asking how many respondents agree that the role of the primary care provider should include identifying children at risk of insufficient nature exposure, assisting them in obtaining nature-related services, helping them develop strategies for engaging in nature-related activities, and being knowledgeable about local and regional nature opportunities. So it looked to be around 66, about 2/3 of our population believe primary care providers should identify children at risk of insufficient nature exposure. But few ask or counsel their patients about nature exposure. So about 11% ask a majority of their patients about nature exposure, 14% counsel a majority of their patients about it, 7% provide resources to a majority, and only 6% prescribe nature exposure to a majority of patients. Next, I asked specifically about the provider's thoughts on horticultural therapy, and I used this definition from the profession and practice of horticultural therapy. And I asked them questions such as, have you heard of HT? Do you understand what horticultural therapists do? And so on. And this is what the data says. Around 9% have heard of HT, 1% have received education on it, 11% were comfortable referring to the program. But just after reading that short definition, 54% would refer to a registered horticultural therapist if available, and 71% were interested in continuing medical education on the topic. And then lastly was just thinking about barriers to why respondents do or do not counsel. And the most prevalent barrier was time during patient visit and access to patient resources. And then lastly, I just wanted to talk about, there was 45 total narrative responses to the survey. A lot of them were just thanking me for the survey, yada, yada. But 17 were really interesting, and they spoke to the importance of safety. So I won't read the whole thing, but what this respondent was saying was that there are really significant challenges with accessing nature spaces. I don't believe that this is an area where physician counseling can overcome these large structural barriers. For example, for the large number of families who tell me that it's not safe for their children to play outside in any of the places accessible to them, I don't think it's my job to question their safety assessment of their neighborhood. This individual felt that the best way to approach this would be to expand school-based programming. So in an urban clinic setting where I worked, exposure to nature is a complicated topic. There should be more school-based programs that encourage exploring nature in a less structured way. And then this one specifically spoke to outdoor safety. Unfortunately, many of my patients tell me that it is unsafe for them to go outside. Several parks have been taken over by drugs. One of my patients was hit accidentally in a drive-by shooting. And the reason I bring this up is because very recently in 2018, there was a study in Chicago showing that greening a neighborhood and greening a schoolyard makes the entire neighborhood safer. The point from this study showed that when you had a green intervention in a schoolyard, you had less sedentary activity, fewer injuries, less teasing and bullying, less gang-related activity, and you had increases in positive behaviors such as positive social interactions and perception of safety. And then speaking to that respondent's point about school-based programs, horticultural therapy has been wonderfully incorporated into particular schools. I'm highlighting here Rich Mateo right here, who I've been able to volunteer with at the Overbrook School for the Blind. And his program is a wonderful place of interactions with green spaces, shepherding these wonderful resources. And this is a model that should be expanded. So there are certainly limitations to my work. This was a regional sample, so our results might not be generalizable to other regions. Our response rate was just about 6%, but I think the quality of our responses was very good, and we had over 200 responses. There might be a selection bias to those with strong opinions, and this was all self-reporting, so there's no data here on actual effectiveness of current counseling practices. And I actually recently received funding from my university to send the same survey to a national sample. And I'm just starting in that process right now. So my research conclusions, most providers believe their role includes counseling on nature exposure, but few actually do it. But I firmly believe the pediatrics community views nature counseling favorably, as over 70% were interested in continuing medical education on the topic. I'm also drawing that from these results that primary care is ideal for providing individualized nature exposure plans with patients, but time during patient visits is a major barrier. So any intervention that can be incorporated has to be one that is either a short intervention or one that is outside the bounds of the typical patient visit. Safety and access considerations are vital in order for providers to want to counsel on the topic. And the horticultural therapy and medical communities require intentional outreach on incorporating HT into medical practice. But the biggest conclusion, and what is so exciting, is it is a great time to be involved in horticultural therapy. There's so much evidence in support of it. It is in so many different scenarios. There's cost-saving benefits of it. And I believe that the entire medical community is ready for it. So moving forward, I see myself as speaking on behalf of two communities. I am speaking on behalf of the medical community to you, to the horticultural therapy community, and I'm speaking on behalf of the horticultural therapy community to the medical community. And I've already started doing coursework at the Horticultural Therapy Institute, and I hope to get my HTR one day. So in terms of being a representative of the horticultural therapy community, I have already presented on horticultural therapy within my hospital system at Jefferson, within the Nemours Children's Health System in Wilmington, Delaware. I presented on this topic at Children's National in Washington, D.C., and I've presented on this topic at UPMC, the Children's Hospital of Pittsburgh. I've also presented this topic at the Philadelphia Flower Show, and I hope to continue to be connecting the two communities together. I've been able to publish in the AHTA magazine on why I think we should incorporate horticultural therapy into every hospital and how we could actually do it. So the bottom of this publication describes strategic objectives toward a horticultural therapist in every hospital. And I just wanted to go through some of these things. And this is not an exhaustive list, but I do think that we should be thinking about strategic objectives. So first is systematically indexing the nature ecosystem of all 6,100 US hospitals, publishing the process openly online. Second is understanding successful examples of horticultural activities and horticultural therapy in hospitals today. Generating an economic pitch with accountants and economists on cost-saving benefits and plans for implementation. And from all of this, formulating individualized plans for every hospital with a particular focus on including that hospital's local neighborhood community, collaborating with research organizations to standardize HT interventions based on time, length, frequency, and also outcome in order for the medical community to feel more comfortable prescribing it, establishing a network of horticultural therapy across hospital sites where data on safe practices and new programming ideas can be shared. And there was a community, and I can't remember what it's called, but that is already growing to do just that. And they published in the HTA magazine as well. Creating an online database of interventions that can track outcomes longitudinally, consulting legal advice for practicing in a hospital, convening longitudinal goal setting and execution meetings between the horticultural therapy community and hospital stakeholders, presenting horticultural therapy research at national and regional conferences, and then publishing HT research in medical journals. And then things that the AHTA community that I think should be considering would be to approach this as a large mission, a large movement, and begin a community listening campaign to ensure as many voices are included during this process, establishing minimum standard wage and work conditions for hospital-based horticultural therapists, continuing to work toward higher credentialing for horticultural therapy, determining how HT program would be paid within hospitals and or health systems, considering an additional horticultural therapist role of working within hospital nutrition departments to champion patients' nature and nutrition continuity of care, recruiting from populations. So the sixth thing right here, I think, is so important. The point is that there is an entire nation of people who could be horticultural therapists, people who might find meaning in horticultural therapy. These are young people in college who are trying to figure out what to do with their lives. These are current healthcare workers. These are individuals looking for a second, third, fourth career. These are retired individuals. So there's tens of thousands or hundreds of thousands of people who might find meaning in this work. Advocating for it at medical schools and other allied health professional training institutions. And then probably the biggest thing is initiating a massive capital raising campaign with the focus on philanthropists who support hospitals and or nature spaces, and seeking out public, private, or nonprofit grants available to fund this work, because this is going to be a big movement. And I think the 2020s can be a absolutely defining decade for horticultural therapy. There are around 250 HTRs today, with only 20 working in hospitals. In my opinion, and I'm stating today, I think to really impact healthcare in a large scale way, we should shoot for having 30,000 HTRs by 2030. And I think that's possible. And I think that's a goal that there's over 6,000 hospitals. There's more than that in terms of primary care settings. If we want to impact healthcare in a large scale way, we're going to need more human power from the horticultural therapy side. And I think 30,000 by 2030 is the way to do it. So just want to say a huge thank you to everyone who has supported me in this process. From the Jefferson Center for Autism and Neurodiversity, Wendy Ross is a pediatrician who's been my primary mentor, and Alexander Fossey is a methodologist who's helped a lot with research. From the Marcus Institute of Integrative Health at Jefferson, from the Jefferson College of Population Health, from Jefferson McGee Rehab, Jennick Lennon Morrissey is a horticultural therapist. Tons of people at AHTA have taken the time out of their day to talk to me and let me interview them to better understand what horticultural therapy looks like through their eyes. And then additional students such as my wife, Jennifer Zeiger, who's helped me a ton with this presentation and everything. And then a friend, Jonathan Ledesma, who's an orthopedics resident at the University of Illinois, Chicago. So just to conclude, these are some slides that I think are fun. But please contact me if you have any questions or would like any of these slides. This is my email address. I want to help. I want to be involved as much as I can. Thank you so much for coming and listening to me, and I'm happy to take any and all questions. Thank you.